On this episode of the ACSELL Cast, we're speaking with Joana Pinto, co-founder and CEO of Clynx, in order to have a discussion on her experiences with the Living Lab approach. Here's the episode. Thank you so much for joining us on this ACSELL Cast and also your willingness to share your experiences with our listeners. But before we get into a little bit more about what you were doing and also your product, I think maybe I should elaborate a little bit the framework because within the ACSELL Cast, well, not the ACSELL Cast, but the ACSELL project, we were able to carry out a pilot action. And in that pilot action, Living Lab methodologies in the form of co-creation workshops and human factor studies were implemented in a trans-regional setting. And that was done by two regions that are part of the project, one by Friuli Venezia Giulia in Italy, and also in Baden-Württemberg in Germany. And these were carried out under the guidance of Lika Lab, which is an actual living lab in Flanders region. And it seems as though, I don't know, experience that you have, that even though some user-centered approaches are not a completely unknown concept, it's nonetheless seems as though not many SMEs are really aware of the Living Lab approach or the benefits that go along with it, such as de-risking market entry by optimizing products and services in collaboration with relevant stakeholders and potential users. But, and for that reason, of course, we're especially happy to be able to talk with you, Joana, on this podcast to report on your experience and whatnot. But before we get into that, of course, it would be wonderful if you could introduce yourself as well as your company and the product.
Thanks for having me, Sandra. I'm happy to share part of my experience at Clynx. So I'm co-founder and CEO at Clynx, and what we do, we are working on the digital health space, more specifically in physiotherapy. Our mission is to make physiotherapy treatments more motivating for the patients, but also bringing more analytical capacity to the healthcare providers. And we are doing this with our first product, Modify Plus. It's called like this because we are actually bringing motivation to the physiotherapy recovery. With it, patients can do exercises while interacting with the gamified approach. So they are doing exercises at the same time they are playing a game, actually. And during these sessions, we are collecting important information about their movements using 3D image technology. Then we provide automatic session reports and progress informations for the physiotherapists to customize the treatments and follow their patients throughout their recovery. And the sessions can be done in the clinics and also at home.
Yeah, it's really an exciting product, and that's why we also, I guess, chose or selected your product for this pilot action. And so, initially we had a call. We, had a number of SMEs who wanted to participate and get their product, let's say, tested. But the question is, why were you interested? Why did you join or apply for this pilot action? Is there some problem that you were trying to solve, or was it just in general an interest?
Yeah, so we are a Portuguese startup. So we started our activities here in the Portuguese market. We run some tests and pilots in Portuguese clinics and hospitals. But at the time we applied for this opportunity, we were looking forward to try the solution in some other European countries. Actually, one of them, Germany, is one of the markets that we are most interested in exploring. So when we approached and when we tried to enroll into this opportunity, it was really because we were looking to test our solution, understand better the market's dynamics, how the solution fits both in terms of validating the technology, but also understanding how would be the best approach to enter these markets in terms of business model. So those were really the main motivations for us to be engaged with the ACSELL project.
Perfect. And, as I was introducing this episode in a way, it's like I said, it seems as though not many SMEs are aware of this. Were you, did you know about the Living Lab approach or in general user-centered approaches beforehand?
We've heard about the concept before. We used to follow some of the some of the entities that are promoting this kind of living lives approach, like EIT Health and other entities in Europe. But we actually didn't had the chance to try it ourselves, at least in a systematic way, let's say, with a group of partners building the whole experience, the whole living lab for our product. We of course had some pilots before, but not really with these kind of methodologies that were implemented by the partners with the ACSELL project, which was really important for us to make sure we were really deploying a living lab that would give us the answers we were looking for.
Glad to hear it. It was quite the fascinating process also for us, of course, because we were, being from the University of Tübingen and also one partner that implemented this methodology. It was really quite. A very systematic approach and really interesting also from our part to be part of this. And so, also what were your expectations going into it? And of course, then also were they met?
So, as I said, we had tested the solution here in the Portuguese market, but we wanted to understand whether the feedback and the results we were collecting here would match with the feedback that we would collect in populations from another markets. That could be a chance, so we needed to validate that. So that was the first answer that we were looking for. We understood that there are some similarities and also some differences in the way that the groups, the people that tested our solution in Germany and in Italy, there were some differences in their perception of the solution, but the most important things were matching, and they were validated with the feedback that we had already collected here in the Portuguese market. So first assumption that we wanted to validate was whether the solution was motivating for the people or not. So whether this gamified approach was meeting our goal of making the exercising more fun and enjoyable. And that part we were able to validate because people reported, the people that tested our solution in the Living Labs approach reported that they find this concept more motivating than conventional exercising, let's say. But then we also learned a lot regarding the differences. So there's some type of gamified exercises that we have that were not perceived so well in some of the groups that were tested. So we gather this info for future iterations in the product. So this part of the product testing was really important for us to understand what would be the most priority features and also gamified exercises to improve within the solution that is already built. This was on the product side, let's say. From the business side, we were also looking for answers regarding the business model that we are following. So here in the Portuguese market, we are addressing directly the healthcare providers. So our clients are the clinics, the hospitals, the rehabilitation centers. But what we were looking to validate was to understand, especially in the German market, that is insurance-based market, to understand whether we would need to find alternative reimbursement strategies and even adapt the business model more focused on the insurance companies, really try to understand these differences. And the pilot actions gave us some insights from the health professionals that gave their feedback during the pilot action, and we understood that entering this market we will need to really consider the health insurance companies and the reimbursement models to adapt our business approach to enter the market.
Yeah, the German market, unfortunately, is a somewhat complicated market, and for that reason, I would assume, yeah, that it would be quite useful to have some feedback on that, and also, yeah, different aspects of need to be taken into consideration with your business model. So, yeah, and in that case, I mean, or in that sense, were there any surprises or other difficulties that you were confronted with when receiving the feedback or working through these different questions?
I'd say the first challenge that we had to face is not directly related with the approach. It was really because of the global context of the pandemics. The pilot actions needed to wait, so they were delayed for some months because of this context that goes beyond or or reach. That was the first challenge. Then we got the solution ready to be used in both idioms, so in Italian and German, because we thought this would be important for the local population in the sample to test the solution. But we only, for the German case, we only translated the game application, and the clinical portal was not translated to German. And what we learned from the feedback is that actually that's a really important step, so we need to be careful with this translation of the solution for each new market that we want to enter. So it's a really basic and simple thing, but it's something that we had to learn. And it's one of those really simple things that now we won't miss when we want to prepare for launching in a new market.
Yeah, as you say, I think it is sometimes these seemingly really also basics that, of course, language, but yeah, it kind of gets, I don't know. I don't know, covered with other more important things, maybe, like, yeah, that language, it's much more important to have, the exercises right or whatever else. But yeah, the communication with the patient, yeah, it seemed like it was really important. And little things can really be irritating for them. So that was wonderful that you say, okay, yeah, this is something that was really important and interesting that you were able to learn. Yeah, so that's good.
One really important thing that we also learned is that when our solution is being implemented in a new healthcare provider, it's really important to have the solution shown by a physiotherapist to the patient. So really that first phase of onboarding the patient into these new concepts, showing them the solution, making it making them feel confident about using it, that's a really important step. We already had this indication from the pilots here in Portugal, but actually the pilot actions were also important to confirm it, because we understood that as the population in the pilot actions, they were not introduced to the solution previously, because it was the way we designed it, of course, to really test the usability and how someone that hasn't had contact with the solution feels for the first time they know it, and how easily they can navigate through it. But then we understood that some details and some usability aspects were not as clear as they need to be for a real patient. So that onboarding phase, we understood it's really important, and that also gives us some indication of how we should proceed with the new clients. So we need um, to show them that the way they should implement it with the patients is by showing the solution. Even if the patient takes the solution home, it's important to have this first contact in person, and with an explanation and demo, real life demo of the solution, so that the patient feels confident. And that's something also important that we validated in these new markets. So it was really important.
Yeah, it was totally, and it was really interesting to see. First to also how different, because it was a combination of pictures and text. of how to carry out the exercise. And it was interesting to see how each person interpreted it completely differently. And there were, sometimes also just two different factions that, interpreted it this way, and then the other faction interpreted it the other way. And it was really interesting just to see, how different it can be understood and carried out based on even, in the combination of pictures, graphics, and textual instructions on how to do it. And yeah, I totally, I think it seems as though it would be super important to have some live demonstration that people can also be sure and confident, as you're saying, that they're doing it correctly, and also maybe some additional comments as to how long they can do it and how much pain should they have, or when do they need to stop, and these types of questions. I think it would be good to have also along with that. So yeah. And so, yeah, in general, I mean, was it a positive experience for you? Is this something that you would definitely recommend for other SMEs to also say, yeah, this is definitely super important when trying to optimize your product, or yeah, improve it?
Yeah, completely. I think for us it was a really successful, extremely valuable experience. And I think that for other SMEs and especially startups that are looking to validate their own concepts or different parts of their own solution, I think this living lab approach is really important because it's a systematic way to test it. Like it's so easy to get biased when you're testing something or some context or some solution or some technology. And for us, this was a really valuable experience because having the support of the other partners in not only in deploying the pilot actions, but also before, like designing the co-designing and deploying the plans for the pilot actions and the whole living lab approach. It was really important to have this support, and it was important also to ensure that we were doing this in a systematic way and hopefully unbiased way, because we want to if we want to retrieve valuable insights from the actions, we need also to prepare it accordingly. And yeah, the Axel project was really important for us to have this first living lab approach, and I would definitely advise it to other SMEs and startups.
Well, great. Glad to hear it that it was in the end a positive experience, because I think, yeah, sometimes, some of the arguments that one might get, from SMEs, that it's just too much resource intensive. They don't have the time to go through these types of validation or testing. And do you have some kind of an argument or a reasoning why that is not true from your experience, or how?
I think it's a matter of timing. I think the concept is really valuable for any startup, but maybe not at any given point in time. So I think the most use a startup can get out of this kind of approach is like either when they're having the idea, either whether they're when they want to test the concept, either whether when they want to test the solution in a new market, as it was our case. So maybe not when the solution is already running, but in some important turning points where there's some really key validations that need to be done. I think it's mostly useful to deploy some resources in trying to validate them in the best way. And I think the living labs are really good opportunities for that.
Super. Yeah, no, that sounds like really wonderful advice, actually, from your side. Yeah, and it seems to make a great sense, really, to try and involve stakeholders or users or whatever, however you want to, uh, specify them, from a more expert, part, or the actual end user, to involve them as soon as possible, really, in that innovation process when you're developing an idea or a product. So yeah, any other advice or what you learned from your experience that you can share with SMEs that maybe wasn't touched yet, or you thought was just really fun, crazy, overwhelming?
Yeah, for us it was a bit overwhelming in the beginning. after all, it was the first international experience for us. So that's also why it was so valuable. I'd say my only small advice is that, continuing on what we were saying, people need to know and founders need to know what they want to learn uh, in each point and what they want to validate. So I would say that the most important thing when designing such living lab is really for the teams to understand and choose what they want to test, whether is how the solution is user friendly or not during the installation steps or during the use itself of the solution, whether they want to validate user experience and design, whether they want to evaluate market receptivity, or as was more our case, to understand what's the best business approach to enter new markets. So these one or two topics, they need to be really clear, because everything from there will be designed around this goal. So I would say that's the most important advice.
That's great advice. Yes, it's yeah. Asking the right questions is really key, isn't it? In trying to move forward, and as you say, and everything's designed around that really, and you want to make sure that that's the question you really care about. So yeah, super. Yeah, perfect. Well, thanks so much. I think that was a really insightful, a very wonderful talk that we had, and yeah, I think. SMEs can learn a lot from this experience. So let's hope lots listen to it and take your advice and your learnings. So thanks so much for joining us.
Thanks for having me.
Our pleasure. Thank you, Joanna, for joining us for today's episode, and thank you, our listeners, for joining us as well. Be sure to check the show notes to see where you can find more information about Joanna, Clynx, Interreg Europe, and ACSELL. ACSELL Cast is created by myself, Sandra Evans, as well as Daniel Buhr and Christine Hopkins.